And thanks to all of you tuning in across the iHeartRadio network. Shout out to the folks listening on News Talk 1010 in Toronto, in Windsor on AM 800. Hey, we're AM 800. Oh, no, we're 800 AM here in Montreal. And also on News Talk 610 in Niagara. Great to be talking to all of you this morning. I just want to point this out. Of course, we've got text lines and phone lines that you can reach me at, 71010 nationally. Of course, our 514-790-0800 number works in Montreal. Let me just tell you this. I want to say a shout out here. Susan sends me a note. She found me on the social media. It's Elias Makos here, and you can find me on Twitter, X, and Instagram at Elias Makos, my full name, Elias Makos. Send me a note if you're listening, wherever you are listening. Really appreciate you tuning in, and a really beautiful, lovely note from Susan listening on this Labor Day. We continue the program this morning by talking about drug policy in this country and asking the question, have safe drug use sites and safe supply programs become political warfare? Some advocates are saying that politicians are using them to score points. But as I look across the country, here in Montreal, in the neighborhood of St. Henry, residents there enraged that there's a safe inhalation site next to a school that is sticking around for this school year. In Ontario, I should note, right, that province announced it would close safe consumption sites located near schools. In British Columbia, families are suing the government, saying that the province's safe supply program led to their children's addictions. So, what does that say about the debate over drug policy in this country? I can't think of a better guest right now than Adam Zivo. He's a columnist at the National Post, also the director of the Center for Responsible Drug Policy. Adam, welcome back to the program.
Thanks for having me on the show again.
Adam, I want you to listen here to Pierre Poilievre, leader of the Conservatives. He was asked a question about evidence of safe supply diversion, and guess whose name came up? Have a listen.
Can you point us to evidence showing that drugs that are given out for free are ending up in the hands of children?
Well, I don't have to. You just have to ask the police, and even the so-called experts have now been caught on television or on tape saying that they're being diverted. And in BC, the Public Health Authority, which has been a great advocate of this radical scheme, has admitted that it's ending up in the hands of children. Adam Zivo from the National Post has done intrepid reporting on this, where he's shown that the cost of a hydromorphine tablet has dropped on the street, has dropped by like 95%, because as soon as the addicts get the drugs, they resell it so they can buy something more potent. And it has being handed off to kids.
That's Pierre Poilievre, leader of the Conservatives, and he's mentioning you, Adam. What's your reaction when you hear the leader of the Conservatives using you in your reporting to make a point?
Well, I'll be honest, it's really nice to hear that my reporting is getting some attention and is making a splash, because I think that greater public understanding of how mismanaged and ill-researched our addiction policies are will help eventually save lives, because we do have to keep in mind that safe injection sites and safer supply do not seem to be as useful as many of these harm reduction activists want them to be, and therefore we need other solutions. However, at the same time, I also feel a little bit disappointed, because I wish that other political leaders would have the courage and honesty to recognize these facts as well.
So let's talk about those facts, because, and I saw the hullabaloo in Ontario when the Ford government there made the announcement about certain sites near schools. And boy, I'm listening to the detractors, those advocates, that they really, truly believe in their hearts this is going to lead to the death of people. That more people are going to die because of this. So, and I'm trying to parse, between the hyperbolic and what reality is. What can you tell us?
Well, so what I would say is that the evidence base for safe injection sites it's more contentious and more ambiguous than it is for safe supply. Safe supply basically has no evidence supporting it. With safe injection sites, there were some questions about the validity of the studies produced in the 2000s when Insight, the first safe injection site in Canada, first opened up. What's interesting is that the initial people who lobbied for the creation of Insight were given a very large government contract to essentially evaluate their own project. And they created over 30 evaluations of Insight, Canada's first ever supervised injection site, which were all glowing, saying that, reduced crime, it led to thousands of referrals to treatment. And at that time, the RCMP was a little bit skeptical of this, so they hired an external evaluator. And that evaluator looked at these evaluations and concluded that they were basically ridiculous, that the harm reduction researchers had overstated positive outcomes and misrepresented what was going on. And I'm going to give two specific examples. So they said, for example, that safe injection sites didn't lead to an increase in crime. And if you look just at the crime stats, you would get that sense. But when that RCMP evaluator spoke with local police contacts, they said they had to bring in dozens of police officers to manage a giant crime wave that came with that supervised injection site, right? But the evaluators completely skipped that. And then the evaluator realized that these thousands of referrals to recovery were essentially just giving people pamphlets. So, Elias, if I gave you a pamphlet and you were to throw it out right away afterwards, that would still be a referral. Yeah. So right from the very beginning of the safe injection site movement, we had very questionable research ethics and people who seemed to be skewing results to meet an ideological goal.
And I'm thinking about the language used, Adam, right? Harm reduction. Some of the it sounds great, right? If you hear someone say this is about harm reduction, who wouldn't be in favor of harm reduction? And then with my eyes, I see locations where they've got the harm reduction sign up on the wall, and in front of it, it's person after person passed out on drugs. And I don't see harm reduction. I just see the words. What about the language that's being used? And on all sides of this, whether you're on the left or you're on the right, what about the language being used?
Well, I think that a lot of this language is propagandistic. I mean, I understand what they're trying to do with the term harm reduction, but I think that it often conceals that many of these policies simply enable harms or seem to produce harms. They'll use things like safe supply to falsely state that pharmaceutical opioids are safe, and then as a result, kids experiment with these drugs and get addicted. They talk about the dangers of the quote-unquote unregulated toxic drug supply, meaning street drugs, and because they say unregulated drugs instead of illicit drugs, they then think that what they're just trying to do, they frame it as saying we just want to regulate drugs instead of legalizing drugs. And they say that, if we, regulate these toxic drugs, we'll have, non-toxic drugs. But the fact is that legal pharmaceutical opioids are also toxic. There's no such thing as a non-toxic opioid, but they use this kind of really manipulative language and manipulative framing to try to control the policy conversation, which I think has been really unfortunate for the past 10 to 20 years.
So there's these accusations that politicians are weaponizing this, right? Trying to score political points. But I want to talk about why that's happening. And I look to citizens. I look to everyday people that are fed up about what they're seeing in their communities. What are we seeing across the country with citizens?
I mean, we're seeing an exasperation with this harm reduction movement, with people saying that they feel deeply unsafe. Let's keep in mind that many of these public health experts said, for example, that drug decriminalization in British Columbia was going to be just fine and it was going to save lives. And that obviously isn't what happened. No lives were saved. And instead, public drug use exploded and people felt deeply unsafe walking throughout their cities. And parents became infuriated with the fact that whenever they went to their playgrounds, they saw syringes everywhere. So I think that there is this deep nationwide resentment for the failed promise of harm reduction, at least as it's been applied recently. And I think that that is driving this political correction. People are trying to frame it as politicians manufacturing some problem, but politicians are merely responding to this public anger. They're not generating it.
Adam, we do have to leave it there. Listen, of all topics for a national edition of this program, I can't think of one that's more relevant than this one. Thank you so much for joining us.
Thank you for having me on the show again.
Adam Zivo, National Post columnist and director of the Center for Responsible Drug Policy.